Today we'll discuss two important parts. One is exceptions in technique. Second, why patients leave. If time permits, then we'll start dream analysis, or we start dream analysis from next time. When we learned technique, we said what ought to be done, what not ought to be done, what is psychoanalytic enough, what is not psychoanalytic enough, what is the reason for doing certain things in technique. And we said we should follow these principles of technique, so to say, in the conduct of psychoanalytic therapy. While we were discussing technique, we always said that there are exceptions to everything that we say. So today what we'll do is we will take up 10 of those exceptions. Naturally, exceptions are more than 10, but for our purpose, we'll take up 10 important exceptions related to technique, and we'll try to understand the rationale of these exceptions, just as we understood the rationale of the general principle. So let us look at today these 10 exceptions. So why there are exceptions in technique? Exceptions exist because psychoanalysis does not have absolutes when it comes to model of the mind, pathogenesis, or technique. There are no absolutes. And because we don't have a comprehensive theory or a gold standard theory, we have competing theories. What happens in the competitive theoretical landscape is different movements in technique, although contradictory in concept, often give good results. And that is where the whole idea of the rule and the exception comes in. That when we say something is a rule in technique, we mean 80% of the times it gives good results. And when we say exception has to be honored, we mean 20% of the time the general rule does not give good results, but a deviation from it, adherence to the exception, that gives good results. So it brings us to a very important point we have discussed before, that every moment in the session is like a junction. Let us say a patient talks about what happened at his office yesterday, and so many different possibilities open up. Possibility one, should we take it at face value and discuss his situation in the office, how he responds to it? Possibility two, should we take it into transference and say, this is how you look at authority figures? This is how you perceive yourself to be a child? Possibility three, you bring yourself in and you say, do you mean to say I am like your boss? Situation four, you may like to offer an interpretation. Situation five, you may like to do holding and not offer an interpretation. So this junction point, you can bring in so many theories, and each theory will tell you what is the right way to go. And obviously, it is your intuition, judgment, experience, and knowledge which helps you pick up the tool, what to deploy at that time. When we go to supervision, it is based upon general guidelines. However, for every guideline, there are exceptions. General guidelines are not cast in stone. So what you hear the supervisors saying is not universally true. It may be true for that case. It may be true for a group of cases. It may be true for 80% of cases. But it is not universally true. It brings us back to what we all learn as a healer, that everything works on someone and nothing works on everyone. So that is something we are brought back to again and again, the sheer heterogeneity of our clients. So the knowledge of exceptions of technique enables us to be open, creative, not be rigid, and not feel guilty or smaller if you deviate, not fear the attack of the supervisors if we deviate. And this is something very important. I have seen supervision getting counterproductive when there is too much anxiety of the supervisor, which inhibits the autonomy and creativity and intuition of the therapist. It's like the supervisor is sitting with the therapist in the therapy room, psychologically speaking. And that is an undoing of the whole intention of supervision. That can bring in too much of conformity, too much of anxiety, too much of rigidity, which is counterproductive. So what we say is, what works.
I did not follow. Supervisor is sitting with the therapist. You mean supervisor therapist or supervisor is being a therapist?
Yeah. So what happens is, as a therapist, one is supposed to go for supervision.
Yes.
And unfortunately, supervision has become more of a fault-finding exercise rather than a therapist building exercise. So what happens is, if you go too much for supervision, when you are sitting in the therapy room with the patient, you want to do something and the supervisor inside your head tells you, you are constantly thinking, what will the supervisor say when he looks at this? So psychologically, the supervisor is present in the therapy room.
Always there. Like
And
a mother-in-law.
correct. And that is
Critical mother.
correct. And that is when it inhibits your own intuition, your own creativity, your own freedom. So initially in the first 2 years, it's okay. It's productive if the supervisor is with you psychologically in the room. But after 2, 3 years of good supervision, you have to let go of it and be on your own. So this is where the initially we need freedom from our impulse and we have to train ourselves into discipline. After some time, we have to be free from the rigid discipline and train ourselves in guarded freedom. So let us start with the first exception. The general guideline is allow the patient to start his session. Don't start the session yourself. Why? Because we want to be guided by his unconscious, not our unconscious. 2, we want to honor his autonomy, his choice. We want him to guide the session where he wants to be taken. He knows what he needs probably better than us. And we say it is his session, not your session. If you go to therapy, you can start it the way you want. But if he comes for therapy, he let him start his session. So it is his session, not your session. This is the general guideline. Now, what are the exceptions? If a patient is depressed, he may just not start the session and you may have to encourage him to start the session. If the patient goes too much in silence, then you may have to talk more and get him out of it. If the person is in psychosis and he does not start the session and he goes into some sort of bizarre behavior, you may have to bring it back on track. If it involves sexual aspects or shame, the person may be hesitating and you may have to help him to open up. If the unconscious relation to the therapist is such that the therapist is seen as a terrifying figure and you know it, then you have to undo that projection as far as you can and allow the person to start the session. If the anger towards the therapist is very high, and therefore the person is holding back, you have to interpret and allow him to start the session. If the person is having dependent personality disorder or schizoidal personality disorder, you may naturally have to start the session probably for much longer than otherwise. If the person is new in therapy, for the first few sessions, you may have to start the session because he is naturally expecting out of social training that you are the expert and you will start the session. So these are the exceptions, that there is a general guideline of technique and there are exceptions of technique. Exception 2, directing the session. The general guideline is you should allow the patient to start the session and go into free association. And while the patient is doing free association, the therapist's attention is free floating. So there is free association of the patient and a free floating attention of the therapist. And at some point, the free floating attention catches an important point in the free association and starts going deeper into the unconscious from that point. That point can be caught by use of our knowledge or by our intuition. So there is a free floating there is a free association of the patient and a free floating attention of the therapist. And when something interesting happens in this plane of free association, the free floating attention converges onto that point and then goes deeper from there into the unconscious. This is the general guideline. The idea is that free association is like water in the sink, that ultimately water in the sink, wherever you pour, has to go down to the center. And therefore, the free association unknowingly will always converge into something important in the unconscious. In that sense, the free association is really never free. It's always associated very strongly to something important in the unconscious. So it looks free from conscious coherence point of view, but it's always connected and never free from an unconscious standpoint. This is the general guideline. What are the exceptions? When free association is used as a defense, which is what ISTDP says, that according to their view, free association is used more as a defense rather than as an exploratory healing tool. So when you see that free association is used as a defense, you can bring in the act of directing the session partly, if not fully. Second situation of exception, conceptually you know what the cause is, and therefore there is no need to find the cause using free association. So once you are clear about the cause, you can straight go to the cause by directing the session to the cause. Obviously, this can happen only in later part of the therapy once you are very clear about it. Something critical left in the last session has to be discussed. And you exercise a judgment. Usually, we believe whatever is important will come up again. But if the situation is such that you fear it may not come up for a long time, or it's better discussed right now given the situation, then you take up something critical of the last session and bring it into the session, which is in a way directing the session. Something critical is being missed. Let us say the client comes, talks about everything but his father. 22 sessions have gone by and the father only has got a namesake mention. So something critical is being missed. Or you just don't get his childhood. Or he talks about everything without feelings. So something critical is being missed. You can take that up and direct the session if the need be. If you have to do focused work on solving some problem, like the client says, I have 10 problems, but I want to focus only on number 4. So let us focus a few sessions only on problem number 4. The rest we'll do later. And let's say you also agree to it. Okay, it's the right way to go. Then when focused work on problem solving has to be done, where the problem is very clear, then you don't want to focus on other aspects of the personality. This can easily happen if somebody comes with problem of examination. That I have an examination to pass and I am not able to focus. I have too much anxiety. Then obviously, even if the person has other issues, you will focus only on that performance anxiety rather than anything else. And once the exam is over, then you will go to other areas. So when focused work has to be done on solving some problem, again, directing the session can be a way out. So the general guideline is free association and free floating attention, the classical movement of psychoanalysis. Exceptions are this, where you direct the session in different ways. Any questions? Yes, please. Sir, you're muted.
Sorry. Free association as a defense. Can we have an example?
Yes.
A person doesn't want you to analyze the issue, the therapist, and therefore he avoids by going into different directions and
Correct.
keeps on misleading the therapist to
True.
avoid analysis.
Correct. That is
Yes.
two more
Yes, sir.
examples can be. One is to make the life very eventful and then report it to the therapist. That don't go to my center, just be involved in the events I narrate to you. They are so interesting, just be there with those interesting events. The third would be, and this is very much used by sociopaths. People who fall in the sociopathic category, the mild to moderate version, and they have a very strong superego inside, very emotional inside. Superego may be latent, but very emotional and very idealistic deep inside. But they had to put up something else to deal with reality. So they have come on the sociopathic spectrum. So what they will do is they will bring to discussion all the, conventionally speaking, immoral events and keep you entangled in them so that you don't go to their core where they are highly emotional and highly idealistic. It's a very strange thing. The third situation can be that one comes and keeps talking about the office and everything else, but doesn't talk about the inner world. And the moment you try to get into the inner world, they bring in something else or they resist. So these are some of the issues where free association can be used as a defense, or it can be repetition of the same thing. That somebody repeats the same thing over and over again, you give the same interpretations over and over again, and then the person complains nothing is happening, it's all repeating. And you have to tell them it's repeating because the feelings associated with what you are saying are repressed. Until they come out, this repetition will continue. And once they come out, this repetition will stop. So let us look at those feelings. Because you also don't want this repetition. I also don't want this repetition. So let us look at the feelings so that the repetition stops. So these are some of the issues where free association can be used as a defense. Just a caveat, some purists in psychoanalysis will believe that this is never possible. And it is just our limitation if we can't see the unconscious story behind what is being said. So that is one very Puritan position of quintessential psychoanalysis. But this is not what most people practically believe.
Essential means I lost the meaning
The,
of that word.
the dyed in the wool hardcore psychoanalysis.
Which means it was not actually free association as a defense, and the analyst failed to get what the patient was trying to convey. That
Correct.
is what a purist would say.
Yes.
Okay, okay,
Purists would
yeah,
say that the
I
free
get it.
association is always associated to something important in the unconscious. It
Mm.
is just that you are not able to link the two.
Yes, sir.
But most people who are practically oriented will say that free association can, in some cases, be used as a defense.
Yes.
3. Exception 3. Working in transference. General guideline. Work in transference. Now, whether you partially work in transference, you will call it psychodynamic approach. When you heavily work in transference, you call it psychoanalytic approach. Now, general guideline will be what the person says, if possible, take it in transference and move from then and there to here and now. That if the person says, I saw two people fighting and one person really beat him up on the street, instead of asking him, how did you feel there when one was beating up the other? Whom were your sympathies were with? That is then and there. Instead of that, you can bring it to here and now. As you say this, what do you feel right now? What feelings are coming up in your body right now? How did you connect? Has it happened to you before? Why is this so important that you're bringing it up here? So this is converting the then and there to here and now. You can analyze it then and there also. In fact, when you start therapy, it's easier and safer to analyze then and there and then bring it to here and now. After the therapeutic alliance has been strongly established. Because here and now is far more disturbing. It will eat into the therapeutic capital, therapeutic alliance capital. So here and now. Second guideline is, if you want to even more rigorously work, then not only bring then and there to here and now, but bring yourself in. Which would mean to say that if you see those two people fighting, one beating up the other, right now between you and me, who is identified with whom? Who is beating whom? Who is giving pain to whom? Who is the helpless person and who is the dominating? Now, here what we have done is, by an act of interpretation, we have converted then and there to here and now, and we have brought ourselves in. Just before it, we brought it to here and now, but we did not bring ourselves in. So this is the core quintessential Puritan guideline. What are the exceptions?
Another way, sir, could be if I read the patient's feeling because he had just come for the session and while on the way he has seen this, then, oh, you must be feeling horrible. And it often makes one lament about the present situation of the world
Right. So,
and then wait for him to dilate or distract or deviate. Is that okay?
yeah, perfectly okay. Let him express, elaborate upon it.
Uh-huh.
Because the very important point in what you said is it's a fresh incident right on the way.
Yes,
But
yes.
take another situation. He saw this fight 3 days back,
Uh-huh.
and now he's
Mhm.
picking up in the session. So it's not fresh anymore from a normal standpoint, but it's very fresh from an emotional standpoint, subjective to that person.
Yes.
So then we get into this. Why is it so important that 3 years back, 3 days back, you saw this, and yet it is so fresh for you that you feel like engaging with it in therapy. So that definitely has a psychoanalytic unconscious story. But in your case, yes, on the way it is fresh. It's very natural for someone to talk something that is eventful and has happened just on the way. It's very, very natural. And that is where the exceptional part comes in. Can we have things which are not transparential? Why should everything be in transparency?
Can I go ahead with this?
Yeah, please go ahead. So the Puritans will say that everything that comes up in the session has an unconscious element to it, and much of it is transparential. More practical people will say that there are things which are transparential, but not necessarily everything is transparential. Let me recollect an anecdote here. Satyajit Ray made a movie, Pathar Panchali, the song of the road. And while he was shooting it, at one point, there was a huge stone. And that stone came up often in the frames of Satyajit Ray. One person took it up as his thesis topic. He wrote something like the story of the stone in the song of the road. And then after some time, somebody asked Satyajit Ray, okay, why in some frames you see that big stone? What is the significance of it? And he said, I asked the municipality many times to remove it. They did not listen to me, so I had no choice but to keep it there. So he did not have any metaphor in mind, but in the mind of the viewer, the metaphor arose.
What is the meaning of the word Pather Panchali?
The song of the road.
The song of the road.
I trust it is so. We can check it up later, but this is what.
Okay, I will.
And the idea is, okay, we should not find transparency where there is none. There can be things which are just themselves. As Freud said, at times a cigar is a cigar. And as Jung said, some dreams don't have to be interpreted. They have to be taken at face value because they say what they have to say. Everything need not be coded. The same logic probably is here, that certain material does not need to have anything unconscious or transferential element. It may just be what it is. From there, of course, one can have a conversation, and conversation can go into the unconscious. So exceptions are, when therapy is new, it is safer to start with then and there. If therapy is with a fragile person, it is safer to start with then and there. If therapy is with somebody very broken, with low ego capacity, low ego strength, better to talk then and there. Only later, after some healing has happened, one can bring it to here and now. And only towards the later part of theory, one can bring oneself in. Because taking it in transference in here and now and bringing oneself in can be extremely threatening and uncomfortable to many people. It can easily be a cause of somebody leaving therapy.
Last thing that you said, sir, is particularly relevant now in these days when the person is fragile. It may be too overwhelming for him to discuss the transference, so that then and there is better.
Correct.
Uh-huh.
Yeah. Only later part of therapy. So you start with safer ways, start with then and there, then slowly move to here and now, and only later of part of it bring yourself in. Because bringing yourself in can easily be interpreted by many people who don't know the subject deeply, and obviously clients are not expected to know deeply. Uh, they can think of you as somebody who is a crackpot. Because when you say what feelings are coming up towards me, they can easily say, what feelings am I supposed to have towards you? I'm supposed to have feelings towards my parents, towards my friends, my enemies. Why should I have feelings towards you? So, when this kind of things are very sophisticated interventions, so only after relatively good psychoeducation has happened in the course of therapy that those interventions are safe to make. Or the client will go out and say that you are perverted or you are yourself a crackpot.
I have a parallel experience, or rather, yeah, a feeling to share. When you make things extremely smooth for the patient, as informal as possible, and the treatment also without bringing in jargon, too much of it. And it happens, all happens beyond the patient's awareness. Then they, rather than valuing it, they devalue it. Oh, you were just chatting with me. Why should I give you the fees?
Correct. Correct.
Mm.
Because they don't realize how much knowledge, thought, and effort goes into that thing.
Yeah, exactly.
It's not
Mm.
easy to say nothing.
Yes.
Uh, so everything is not transference. You can have healthy parts of the ego and healthy parts of life. Everything need not be pathological. And don't evoke such pure transference that neither of you can handle it.
Ah,
So if you ask the question, how human can you be in therapy? The answer is how much pure transference you want to evoke. The more you follow the frame rigidly and less human you be, more purer and deeper transparencies will evoke. The point is, do you want it and can you handle it? It's not easy. It can have explosive consequences. Some people may eject out of therapy because the pure transparencies are very unbearable. So, how deep you want to go, how pure a transparency you want depends upon many factors. One is, do you really want it to be evoked for something? Is it purposeful to evoke it? Two, are you skilled to handle it? Three, does the patient have the capacity to bear it?
absolutely.
So unless this is very clear, there is no point in evoking very deep, pure transparencies by implementing the frame very, very strictly. This is very good if you are doing training analysis. That the person is coming to you because he wants to become a therapist. And as a part of his therapy program, he is undergoing analysis. So in those kind of situations, it's very good. Somebody is coming to you not with a fragile constitution, but who has a mild to moderate issue and is more interested in the Socratic way of knowing oneself, then it's okay. Somebody has high capacity, it's fine. Somebody has been in therapy for a long time and always had good capacity, and you feel that now you can bring in that kind of language which will facilitate recognition and evocation of this kind of deep pure transparencies of the very early life of part object stages, of stages of confusion between part object stage and the full object stage, or confusion between two full object stages, two full objects who are radically different. You can easily have those hermaphrodite kind of transparencies, the confusion of the mother and the father, the failure of the split to operate.
Can
So,
it not be healthy also? Can
uh,
it not be healthy also that I can have a transference? Uh, I can relate to the analyst, like certain components of the therapist are like my mother, and others are like my father. So the wit and uh, sharp kind of talent can be like mother, and forgiving stance and uh, acceptance and tolerance can be like the father.
Uh, Ardhanareshwar is
Mhm.
coming together of the feminine and the masculine.
Yeah.
It's not confusion of the two.
Mm.
So what happens is in early life, it has to be separated. That one has to clearly identify separately one's masculine and feminine part and then go into synthesis.
Yeah.
Now, if one is not able to separate and confused, so the synthesis is a post-separation stage. Confusion is a pre-separation stage. So if the person first looks at the father in the therapist, then the mother in the therapist, and then both in the therapist, it's a very healthy thing. But if he is confused right at the beginning, that I don't know who you are, I can't see you as a father or a mother, it's a confused, what are you? So that is a pre-split stage. And the pre-split stage is a difficult stage, which means that something is not allowing split to operate. And split is one of the fundamental cognitive mechanisms to first establish itself before more complex mechanism of synthesis can come in. So if a more elementary, rudimentary cognitive mechanism cannot establish itself, it will produce some sort of cognitive difficulty. And that is where we don't want to go into those kind of transferences which we cannot handle, or which the client may take a very, very long time to really get past it, because these are very deep-seated issues. They are part affective, part epistemological. And to go to that kind of level of analysis, one, it will take years. And second, one, it will take very high capability on part of both of them to really go into it. So one of the difficulties is that if the person is such that rigid application of the frame can take the person to those kind of levels, it's better not to go there. Now, if you have psychosis, there is no way but to go there. Because once you get into very difficult psychosis and you come to conclude that what is at the root of it is not a Freudian phenomena but a Kleinian phenomena of early life, then of course you may not have choice. But in most cases you have a choice, and there don't dig deeper than necessary. So how far to work in transference is a judgment everyone has to take. My preference is to uh, use this occasionally and use it slightly less than projective identification. Because you use less does not mean it occurs less. The two are different. It can occur, you may know it, but just because you know it, you don't have to use it. Say, for example, with a client, you are sitting and suddenly you start having sexual fantasies for the client, and you are sorted out inside, you know it's not your material. It's a counter transference. Now, because you know it is occurring, does not mean you have to bring it into discussion right then. You are very clear that the Oedipal transference has started, which is a good sign that you have entered significantly into the unconscious of the client. But just because you know it occurs does not mean you have to bring it into discussion. So I use it lesser than projective identification. Especially Oedipal transferences are very difficult even to discuss given the Indian situation. often we let pass of certain transparencies and we don't interpret that. There is an old saying, brilliant interpretation and the therapy ended. We don't want that to happen. And we also don't want the person to go out and say ki the therapist is a pervert or a crackpot. We also don't want to bring in what he's not ready for. That you may have a counter-transferential experience right in the second or third session. Now it's too early to bring in Oedipus into discussion. So based upon the therapist's preference, his school of training, the social situation, the situation of the patient, his healing process, you decide how far to work in transference, which transferences to bring up in discussion. So the key point is that just because it occurs and you know, does not mean you bring it into discussion. Exception 4. Therapy outside the room. General guideline is no therapy should happen outside the room. If the patient calls you, tell him you can call him only in emergency, and that too through your secretary or somebody. Or if there is nobody, then you ask him only in emergency you can call me. If there is no emergency and you still feel like talking to me, which means you need more sessions. So if you want to talk more to me, go for more sessions. But you can't call me outside of the sessions. Reason being, many patients would like therapy to go on 24 hours. Many patients would like therapists to be on call anytime. It's an ATM, anytime therapy. Many patients would like to be free from the frame and have that omnipotent good mother or omnipotent good father always on demand. So, general guideline is no therapy outside of the session. What are the exceptions? Some people need 2 sessions but can't afford to. And they don't want to go for subsidized rates. That may be one situation. Some just can't come often. They live far away or some places.
Excuse me, sir. You said subsidized sessions by you or by someone else?
By us, for example, you tell the person, I charge, let us say, X amount of money per session. He says, my financial condition is not good. So, okay, you say, okay, I have a sliding scale. I will charge you 0.5x. Though he asks you, how low can you go? So you say, the most affordable I can go is, let's say, 0.25x. Below that, I can't take, I will refer you to somebody. So if it is 0.25x and he knows you, this is rock bottom, but he can't pay 0.25x even for the second session, but he needs it. Now, one way is that you give him free sessions, or let us say you go down, but if you can't go down, then one practical way out can be that you may not have a full session, but you may talk to him for 10 minutes once or twice in the week. And that helps him. So it's like you're violating the rule of no therapy outside the session. And you are doing it even in the form of variable session. Second violation. So, but yet practically in some cases there may be no option but to do it. Some clients will not have any good object around them and may disintegrate because of something which happens at home. And they may need to talk to you for 5 minutes, and just listening to your voice or seeing you, they may feel calm and peaceful because they look at you as a safe good, reliable, stable object. And they may just need 10 minutes of being with you to calm them down. And in such cases, one may have to make an exception. Somebody has an anxiety attack, and you may have no choice but to make an exception. Somebody surrounded with difficult events around him, like somebody's father is very sick, and you never know when he's going to survive or not survive. And again, he has an economic crisis, his job is not stable, surrounded by so many difficult events that the person may need repeated talking to you. Somebody has a stressor around, a boss or a dominating parent or a dominating spouse or somebody. The stressor is around, and the moment the stressor does something, this fragile person disintegrates and he has to talk to somebody who can re-establish that safety in him. Or it helps the therapy process. That you may have to give some material or give some guidance, and you send it on WhatsApp or email. That may help the therapy process, although you are getting in touch outside of the session. Now, what are the steps of caution on the way when you do these exceptions? First precaution is hold the frame as far as you can. Don't let the whole frame go, because you never know when the person will need therapy again. In case it's an ongoing case, of course you have to hold the frame, there is no question. But let us say you had a patient who was with you for 2 years, discontinued 2 years back, and now suddenly calls up and talks to you for 3-4 minutes and wants to talk again for 10 minutes. Now, just because he's not in therapy anymore, don't let the frame go. Still hold the frame as far as you can, because you never know when he will come back again. So it's always better to hold the frame as far as we can and not let it go unless you are very certain that the person is healthy enough not to come back again, or if he gets unwell again, he'll go to somebody else. So in that case, the frame can be compromised to some extent, otherwise you hold the frame. Second, avoid clinging, because the moment you offer this, there'll be a set of patients who will start clinging to you. So don't allow out of the session talk to result in clinging. This can easily happen in case of those with very high anxiety, with paranoid personality disorder, with uh, dependent personality disorder. In some cases, even with the histrionic, once the projections have taken place. It can lead to drawing the therapist in to the playground. Once you start prescribing in the session or taking interest in the life of the person outside of the session, you can become a player and not remain a referee anymore. And we don't want to be a player in his playground. We want to be the umpire. And the clients will try to draw you into their playground. So this is another element of precaution we have to be aware of. And whenever we do take exceptions, always taper off all the exceptions. We have to always remember that exceptions are there as an exception. And they are there on a temporal basis. They have to be tapered off. We can't make a rule out of an exception on a permanent basis. Exception 5. dual relationship. General guideline is we should not have any relationship or contact outside of the therapy room, not even in social functions. Meaning, if you and your client come together in a marriage reception, the moment you see him, one of you should leave. Now, that's a very Puritan approach. If you can't leave, just don't have contact. Don't go with your plate and start talking to him while both of you are having lunch. What are the exceptions? In a small town situation, it's very difficult. The best way is not to engage, just have a smile and walk out, but walk away from him. Even though both of you are in the same hall, don't engage with him. In some social situations, it may not be possible to avoid. So you are both there, but just don't engage with him. In a small town, it's difficult to be anonymous because everyone knows everyone. So you may not be able to maintain anonymity. And third, if there are very few therapists in the town or city, again, it may not be possible to maintain anonymity or avoid a dual relationship in a long distance way. That you are related to somebody who is in business relationship with somebody, and that person is related to your client in a distant way. So in a small town situation, it's very difficult to avoid indirect associations. But direct we should always avoid. Never get into a business venture or a joint paper publication with any client. If you are in a small town or you are in an extremely specialized area and you are offering a course, let's say psychoanalysis, and there are very few psychoanalytic therapists in your town, and you have students, then you will be the teacher, the trainer, and also the therapist for the students. You can't avoid dual relationship there. This is an exception. What has to be always avoided is this, that you cannot make an exception to number 5, that always avoid any profit in cash or kind from the patient and never get into relationship with the patient. So this is not covered by exception of dual relationship. Point 5 is not covered. Actually, I should
Take it up.
Yeah, it is confusing. So this is not allowed under any situation. Exception 6, giving knowledge to the patient. General guideline is therapy is not teaching, it is self-discovery. And if you tell the theory of why the problem exists, it won't solve the problem. It's a very experiential self-discovery process. What are the exceptions? Everyone is not Freud. Don't expect everyone to rediscover the principles. You can expect them to rediscover the application of principle specific to them, but not the principle. And this is what happens even in ISTDP, which wanted to be a completely a theoretical venture. That when it came to split and the Oedipus, they had no choice but to bring in theory. Of course, you don't teach theory as theory. You talk in terms of something specific to the person. So this is an exception, and Girendra Shekhar Bose, the father of Indian psychoanalysis, he used to use this very effectively. Like, how do you bring in Oedipus? It's such a taboo in India. So he would give some part of some pages of Freud to be read by the patient. And when the patient reads it and comes back, he feels more confident to engage with the taboo subject. He also knows that somebody who is great in the world, who has written books, is saying this. So when the therapist talks about, he doesn't look at therapist as a crackpot. So one can, in exceptions, give readings or give a YouTube video for somebody to see and come back, because that can lubricate, ease the process further, especially related to taboo subjects. Second, if somebody is of a personality type where specifying a suffering and telling the person that this is what it is and it happens to many people, the specification itself brings him relief. It's like the word closes the infinity. The moment you give a name to it, it closes that infinity. Okay, what is happening to me? And he's thinking of 100 different things. It's closed. Now he knows exactly what is happening to me. So the name closes the infinity and the person feels better. The person also feels he belongs to a community. He is not alone, condemned one, abandoned one. That he belongs to a group, and a huge section of humanity suffers what he is suffering from. When there is something deeply Oedipal to be looked at, it's fine to give somebody something to read or something to see. Or when you're talking of personality disorder, and this I have used many times after I conceptualized this Valley Junction model, which is a model of personality disorders based upon early life loss. So when I wanted to use this, I often take some time, almost 10-15 minutes of a session, to explain this to the client. Of course, you don't explain his theory, you talk in his subjective terms, his specifics. But I take that time to bring it in, and after that, the acceleration in therapy is very high. So if you believe that some model can be very useful, then not as a theory, not as a class, but contextualized, specified to him in his own subjective language, in his own subjective terms, using people who are of significance to him. If you can bring that in, even if it takes 5 to 10 minutes of discussion, and it may mimic like a class, it's not exactly a class, but it mimic like a class, it's perfectly okay. Because my experience is that post it, conversation becomes very easy, acceleration becomes easy, the person starts noticing what he did not notice before, he brings in that material, and is also able to understand what's happening to him much better. And the cognitive work gets finished much earlier than in a natural procession. And therefore, more quickly, you can move to the affective part of it.
So, did we cover belonging to a community and Oedipus as the exceptions?
Yes,
Mhm.
the 2 and 3 go together actually.
Okay.
Because the moment you give a name to suffering,
Yeah.
the infinity closes. Otherwise,
Yes. So, how do
hypo-
they belong to a community by giving name?
when you say that what you are suffering from is X,
Uh,
and you don't have to worry, 10% of humanity suffers from it.
uh,
So now he knows he is depressed, and he knows hundreds of people are depressed.
mm.
And I am one of them, so he feels belonging to community. Till then, the hypochondriacal nature will force the person to think of 100 different things what has happened to him. And he will feel like he is the only one who is the condemned one, who is suffering from this, who has been the abandoned one. But the moment you give a name, the name not only limits the possibility, but the name also gets the person to belong to that group which is suffering from that name, the problem signified by the name. Exception 7. Do we bring in relaxation techniques? General guideline is therapy will use only classical interventions. Therapy is not a relaxation or a yoga class. What are the exceptions? At times, anxiety can go very high and all your classical interventions fail. At such a time, there is no difficulty in bringing in any relaxation technique. Because all your interventions are failing. At that time, if you bring any anxiety regulation relaxation technique, and there are many of them, a simple can be just focus on your breath coming in and going out of your nostril. Second, just close your eyes and focus on the sounds you hear in both your ears. Third, just breathe deeply through the nose and exhale very slowly through the mouth. And do it 7 times. One set is of 7 times. You can do it a set of 5 times also, set of 3 also. And after some time, repeat the set. You can see the palpitation going down by all the 3 techniques. So you can have many others. So can we bring in? I would say yes, because in most problems, what is common is lack of relaxation. It's very difficult to have somebody have a psychological problem and the person is relaxed. So relaxation, in my opinion, is a good thing to bring in whenever need be. And if the need is not felt in the session, I would still ask the person to do it as self-work when he goes back. That learn this technique right now and go back and practice it. If there are medical complications, that the person has too many medical complications, he just can't, he's anxious all the time because the medical complications are difficult. He's not sure whether they will be resolved or not. In such cases, always good to bring in relaxation. He has not seen peace in days and weeks. He has been anxious for last week. Again, a good place to bring it in. You can often ask him, does he want it? And if he says yes, then you can give those tools. Good way to do it is, if it's an emergency, you have to no choice but to do it when it arises. But if it is not an emergency, then towards the end of the session, you can give the techniques and end the session. Don't practice Reiki or pranic healing unless the patients know it. Because if you're practicing Reiki or pranic healing, I have seen some therapists who know psychoanalysis also and who know Reiki and pranic healing also. And in the session, they try to give Reiki or pranic healing to the client even as the psychoanalytic part is going on. And here, if you can do it without disturbing the psychoanalytic process, it's fine. But if you have to do some actions which make you look like a crackpot to the patient, don't do that kind of thing. Or even if you can do without any action, but your concentration is broken, don't do it. Because it will be like you are nowhere. If you can't concentrate on the analytic process, it's of no use. Then the better part is concentrate on the psychoanalytic process in the session, and after the patient goes, give him Reiki or pranic healing. A much better way. Breathing techniques or light white relaxation, these are safe tools to use for relaxation. Both of them are available on YouTube. You can just try them yourself first, and then if you feel it good, you can pass it on to patients. And like everything else, every technique does not resonate with every patient. So some relaxation technique will work with some group of patients. So have a basket of tools, and whenever you need, give it to the patient. Exception. Living beyond reflecting. The general guideline is reflecting, not acting. At times, it may not be enough. So in behavioral therapy, if a patient is such that behavioral intervention is a must, then one can go beyond it and say, I will not be limited by reflecting, not acting. I will get into living beyond reflecting. I may not be doing that. I may ask the patient to do it with somebody else. But I would recommend the patient to get into this living beyond reflecting. You can still maintain the frame, not get with the patient into a behavioral situation, ask him to take help from somebody else. If there are very sticky habits which would not go, then experience is the only way out. And there one has to go into living beyond reflecting. If there is an obsession or an unsatisfied desire, again the same thing, that experience is the best teacher, best healer. If you want to test gains out of therapy, then the testing ground is experience. If the person wants self-object experiences beyond what you can give as a therapist, it is best to allow the person to have them in real life. If there are too strong fantasies, again, living out is the only way out.
Self-object experiences, we mean self as an object?
Yeah, like it's actually a self-hyphen object.
Hyphen should be there then, no?
Yeah, self-hyphen.
Uh-huh.
So what we talk in Kohutian terms, that the other is not completely independent of us, but acts as an extension of us. And those are the experiences the patient needs to get well. And there are limits to you as a therapist, how far you can go. That you cannot become a dependent lover of a narcissist. That he has to find somebody in the real world. So if you allow self-object experiences, but if it comes to a point that even in the Kohutian frame you cannot do that, then the best way out is to have experience in the real world. If catharsis is not happening in regular course, then the best way out would be to have a kind of active cathartic immersion. It can be in psychodrama, it can be in active meditation like AUM or anything of that type. Or even experiences in Tantra. For example, they would go to the crematorium at night and face fear face to face as much as you can.
What is AUM, sir?
It's a active meditation by University, and it stands for Awareness Understanding Meditation. If isolation of affect is not breaking through, then one may ask somebody to go into some place where it can break through. It can be psychodrama, AUM, it can even be a devotional place where one can experience those emotions and get in touch with one's affect because it's completely isolated. Devotion can be a good way to get in touch with at least positive affect. If amnesia is not breaking through, maybe a revisit physically or meeting those people again can be helpful. One can revisit and relive for processing and closure, not only for pathology, but even for quality of life. That after the midlife, it's always better to go back to old places, old people, re-engage and have a closure of a different time. It enhances the quality of life. Not only does it help in pathological part. If you feel that the healing has proceeded to 80-90%, but it's not proceeding any further, there is a stalemate. Now only experience can help. In such situations, again, living beyond reflecting can be accessed. Self-revelation. How far can you be anonymous? How far can you reveal? General guideline: be anonymous, be blank screen, allow pure transference to happen if it happens. Exceptions: if the split is open, too pure or transference can be threatening, or envy can be too high, the person may not be able to bear it. So their self-revelation will help. It will bring in reality and you will cease to be omnipotent, at least partly. So it's a very purposeful self-revelation. If the shame, yeah,
I agree. I have the experience of a similar thing, and patient told me that yes, we do not disclose all our assets. कारण लोग को जड़ता
correct,
जलन होती है लोगों को.
correct. So,
Envy is too high, so
so anxiety can become too high or envy can become too high. That if you appear as all good, envy will be unbearable. If you appear all bad, the anxiety will become unbearable because the split is open, either way it can go. Shame is too high because it thinks of you as a completely perfect fortress, that you have committed no wrong in your life. Then the shame is too high. Sharing real life experience becomes difficult for him because he thinks of you as too high and himself as too little, too banal, too trivial, too insignificant. If the blank face leads to an interpretation that you are cold, that you are rejecting, some people can interpret that as cold and rejecting, then it provokes anger, pain, fear. It reignites early life abandonment. It reignites early life coldness. It reignites early life rejection, early life disinterest of the caregiver. So again, here self-revelation will help. And here the self-revelation is not in the form of information about oneself, but about being a warm person. The warmth emotionally which comes in your voice and in your body language. That warmth in you as a person, not information about you, helps here. Point number 4. Point 5, warmth is sought for internalization. The person wants to internalize a warm, good, reliable, stable object. And if you remain blank screen, he is confused. Are you warm or are you not? Should you internalize or should he internalize or not? And this is the core of his healing, that he has to internalize a safe, warm, good, reliable, stable object. And he is just wanting to make sure that you are that. And there, your warmth and your self-revelation in terms of being a warm person helps. So these are the exceptions to the anonymity.
so there is a typo there.
Sorry?
There is a typographical error there. Internationalization it is become
Oh,
rather than internalization. Yeah.
we will not analyze the slip that I have made.
And we will not analyze my pointing out. Thank you.
Exception 10,
Yeah.
dream analysis. General
Uh-huh.
guide. Ask for dreams only in the initial sessions. Once the
Mhm.
therapeutic alliance is strongly built, don't ask for it. Take up dreams if they come up in free association or if the patient brings them up. General guideline. Exception, you feel something is hidden, it is strong, but just not coming up in discussion. Like you suspect the person comes with an OC of guilt. He is washing everything, washing his hands, washing things, and so on. All probability points towards a Oedipal kind of guilt. But nothing Oedipal can come up, and the person is too traditional to talk to. Let's say you are a man and the lady is of 45 years of age, and it's extremely difficult how to open up the conversation on Oedipus. You may ask the person to look at the dreams, it will come up in the dreams. Previous dream analysis has proved very productive, and therefore you know that works with this person. So if it's working, maybe you make an exception and ask for dreams. You can even ask the person to keep a notebook and note down his dreams. If you feel the person is very imaginative and his imagination has a strong connect to affect in the unconscious, and active imagination can be a good tool, then make an exception, go for active imagination. So there you can just ask him to imagine something while he's in the room, or take up a part of the dream he has brought for analysis and expand on that part. One dream well interpreted is worth 25 sessions. So, and dreams can become the prime tool of communication in some cases. That the most repressed things they come up only when they narrate the dreams. Otherwise, they're talking in the session about less repressed things. And the most repressed are reserved for the dreams. So in such cases, ask for the dreams. So these are the 10 exceptions. There are more, but just to make the point that nothing is cast in stone, it is contextual to the patient and the process. For that, I have taken up these 10 exceptions. So with this, we complete 10 exceptions. Let us break for a cup of tea and come back with why patients leave. I'll send a new link.
Okay, sir.